All right, so today we're going to be talking about sciatica during pregnancy and why a lot of pregnant women have trouble with the sciatic nerve during pregnancy. Now, sciatica, common condition, what happens is these three nerve roots right here can become impinged either by a disc protrusion, poor alignment of the spine, or a muscle that attaches inside the sacrum or the tailbone right there, called the piriformis muscle. So the sciatic nerve goes through here and then it comes down, goes to the back of the leg, and then people will get what's called radicular numbness, tingling, or paresthesia. It can go all the way down to the foot, commonly through the back of the leg. Now with pregnancy, very important alignment is going to be the side alignment. So normally, a normal spine, if the head is right here, you should have your neck curve, and then this is your mid-back curve, and then your low back curve. So sort of this S-shaped curvature, okay? And then this would be the tailbone. You would have the legs and foot through there, okay? That is a normal side alignment of the spine. However, what happens during pregnancy, the mother is getting ready for birth, so some ligaments start to relax. There's a hormone called relaxin that is released in order to get prepared for birth. This would be opening up the birth canal and then the carrying angle of the lower back. So obviously there's going to be a baby right in here in the uterus, and as this hormone relaxin starts to take part, what happens is the carrying load shifts forward like this, and then we almost get this. So you have your pregnant belly here. Obviously, I'm not pregnant, I just have my dad bod going, but basically it starts to go like this. And what that looks like in a pregnant female as pregnancy progresses, so here, here, and then this big swooping curve starts to happen because the weight has shifted forward, and then all these ligaments start to relax, so that way we can get ready to have the baby. Now what this does is it creates tremendous amounts of stress, strain, pressure through these lower back, not only the joints, you can develop irritation between these joints called facet syndrome, and then if that can progress, what will happen is these nerve roots, the hole where the nerve exits, starts to get smaller and smaller as we go back and back and back like this. This is called a hyperlordosis, okay? And this can lead to sciatic problems, disc problems, those sorts of things. Another common area could be the piriformis muscle, a little bit lesser common than the low back. There are certain stretches, those sorts of things that you can do to help out with this. Now, one particular thing that you can do to help with sciatica, I'm going to grab something here. If it's being caused by the difference in the carrying capacity of the lower back, what you can do is you can take a large book, lie on your back, place it right here, and what that'll do is that'll scoop the sacrum back underneath and take pressure off the low back, temporarily reducing the pain or the sciatic-like symptoms. Obviously, we want to have a more proper correction of this. This is where adjusting the sacrum and lower back through the use of a chiropractor, some sort of drop technique, or some manual adjusting will help pregnant women deal with that sciatica in the lower back. So if you guys have any questions, go ahead and place them in the comments and I'll try and get to them. Thanks.